Hey, it's the 7th of October 2014, and I am 1 month and 2 days on testosterone. And today is exciting because it's exactly 1 month until I have top surgery. So we are in the final countdown, officially. I'm nervous as heck, but I think I'm ready. I feel like emotionally I'm ready, physically I'm ready. I'm feeling pretty healthy at the moment. I'm not smoking. I did drink on the weekend, but that is my last, that was my last going out before surgery, because I don't want to, I don't know, I guess I want to be as healthy as possible so there's not many complications. So I'm trying to eat really healthy, I'm already relatively healthy in terms of I'm vegan and I don't eat anything particularly shit, but I'm just trying to be extra careful and eat lots of kale and broccoli and greens and make sure that my iron's okay. And I'm gonna go have some blood work done to make sure that all that's good. I have my pre-op tomorrow with Dr. Andrew Ives in Melbourne, who is my surgeon. So that's 10 a.m. tomorrow, which I completely forgot about, and luckily they sent me a reminder about it because I was meant to be working and I got someone to cover my shift. So at the moment I'm still I'm trying to be organized, but I'm such a disorganized person, and having this kind of big operation, I have to be organized. I have to fill in lots of paperwork and make appointments and make sure that I have all my money organized and it transferred to the right people at the right time. And to be honest, that's the thing that causes me the most stress. I'm not particularly stressed about I'm not particularly stressed about the physical element of the surgery or having it. I'm stressed that I will forget to pay beneath a test and they'll cancel it, or that I've miscalculated something, or I'll forget a form, or I'm such a scatterbrain that, my biggest concern is being organized, and that for some reason I won't be. So at the moment I'm just trying to make sure that I have all my documents in order. There's still a few things I need to do, like my name on my private health insurance I think is still my old name, but I think everything else is updated now. So yeah, just those few things. Making sure that this chicken is she's going to stay with my stepmom for a month, who is her other parent. We dog share, so I won't have her for the month, and I will be staying with my mom and my stepdad for a week after the surgery, and then I'll just be at home. So yeah, the next kind of month is just working as much as possible to save as much as possible so I can take as much time off as possible. And I need to get ready. I need to set up my place for post surgery. Because I will have that first week with my folks, but then I'll be by myself. I mean, I have housemates who are really wonderful and I have lots of friends around, so I'm not by myself, but I still need to be organized. And then if you can tell by the current state of my bedroom that I probably need to make it clean and sanitary and have things in obvious places, not the wardrobe that I have at the moment. So yeah, that's what's happening this end of my life is organization and way too much work, which is making me into the world's biggest grump. I'm really looking forward to having some time off. Something that I've been thinking a lot about recently is because top surgery has taken up my thought space, my mental space, for such a long time now. It's been something that I think about all day, every day, some days. And I'm either planning for it or trying to be okay because I haven't had it yet, and having dysphoria has definitely impacted significantly on just time that I spend thinking about it is huge. And the reality is that in a month, like, that is going to be really different. And it's kind of like, then what? I've been working so much for the last year to pay for it. I don't need to work that much after I've had it. I don't know whether to go and study, to go and travel. I'm looking forward to having more time on my hands that I can be involved in something that isn't just my transition, because I feel like I've been in this really like internal space for a really long time, and I'm looking forward to doing something that's not about me, not about my body. I would like to travel or study. I think possibly both. Although if I travel, I have to leave this. Keep my snoring. I'm making this on the floor so that I didn't get her snoring, and she's edged closer to the laptop, so I apologize if it has dog snores all through it. I've been looking a lot recently into moving to Berlin. I kind of am in this space at the moment where I just want to be surrounded by like radical queers everywhere all the time. Melbourne's pretty good with that. Like, it's got a pretty awesome queer scene. But I would really like to explore other parts of the world. But for me, I think it's really important that I go somewhere that is progressive and that is, I don't want to go somewhere where I have to be stealth. Especially because I don't know if I'll ever pass. Like, to be honest. I'd like to be in a really, I guess, accepting, progressive place. And Berlin's looking like a pretty good choice at the moment. So I've been looking kind of casually, but kind of not casually, at flights and kind of what works around there and what the rent's like and just what's happening in the queer scene in Berlin at the moment. So if anyone's from Berlin and wants to send some information my way, I'd totally be up for that chat. So whatnot. Yeah, I think that's all I have to say. I'll let you guys know how the pre-op goes and what they tell me to do pre-surgery. I'm sure it's the fasting and then don't have aspirin and I don't know, don't eat garlic or something. I'll make a proper update about how I actually prepare for top surgery. I might even make one about like what I do in terms of how I set myself up at home for after that first week when I am predominantly by myself. I'll make a video about what I found useful. And yeah, cool. I hope everyone's having a good Tuesday. Hope everyone's having a good Tuesday. And I will hopefully talk to you